Dr. Jean Kaseya, please take a seat over here. We were going to
Please
play.
welcome His Excellency, Dr. Jean Kaseya, the Director General of the Africa Centers for Disease Control and Prevention, to discuss the state of global health with Foreign Policy's Andrew Solinger.
Dr. Jean Kaseya, you're so important. We introduced you twice at the World Health Assembly here, Global Health Forum at the World Health Assembly. Thank you for joining us. We know you have a super busy schedule. We were just talking about this, and we want to kind of pull into what's working with the Africa CDC and some of the ways that you're approaching the conundrum and opportunity that I just described. So to kick off, you have said in past and emphasized that African solutions to African health challenges are what's needed. What does real health sovereignty look like right now for the continent?
When I think about sovereignty, I think about innovation. But before saying that, let me tell you that you wanted to create trouble in my life. Why I say that, you know, I have the president of Angola speaking today as a special guest to WHO. And the president of Angola is leading the African Union. I'm head of organ of African Union. You know what I did? I went to apologize. I said, President, I'm invited to FP event. He said, oh, this is important. Please go. You'll miss, but go.
We're honored. Thank you.
Because FP is more completed the way we are approaching our issues in Africa. And to come back to what you are saying, when we talk about innovation, we are talking not only about the programmatic innovation, it means digital health, telemedicine, AI. We are also talking about innovation on how we are taking over. We are taking back our sovereignty in terms of health financing. Please go to the Africa CDC website, look for this book. You know, the trend today is all African leaders and head of state, they want to take a photo with this book. It's like when the Me Too movement started. Everyone wanted to take a photo with Me Too. Now they are taking photo. Even Tedros took a photo with this book. This book is a blessing that we have in Africa in terms of rethinking our health financing when we are experiencing the head cut. We are impacted. But we are also talking about another innovation that is how to reform our policies. We are talking about local manufacturing. Are we buying our own product? What is the barrier? And we are also talking about innovation in terms of how are we reshifting the global health architecture. Today, for the very first time, Africa is leading response to major outbreaks. Take Mpox. Africa CDC declared the public health emergency. Africa CDC decided to put in place the incident management support team. With my brother Tedros, we say, let us call it that. We have 28 partners coming together to respond to Mpox. And I was briefing my leaders in February. For your information, for the very first time, they gave an award to Africa CDC to end organ. I think we are proud of that, and we are looking for solutions for African problems.
First of all, thank you for joining us. The name of the book, the title is Africa's
Health Financing in a New Era.
In a New Era, a concept paper from April, from
Yes.
last month, so please do have a look at that on Africa CDC site. I want to unpack a little bit of what you just mentioned on financing, but I want to first start with Mpox. So when you declared Mpox a health emergency in August of 2024, there were cases in 6 countries, and as of last month, 21, is that accurate?
Now 24.
Now 24. How is Africa going to respond to outbreaks like this without that financing support from organizations and governments like the United States?
I said to my communities and to my countries, I feel proud to be African leader. You know, for all outbreaks that we had in the past, all of them, no one in Africa could give you data. No one in Africa can give you how much we're receiving and where money was going. For Mpox, I'm able to tell you how much we received, where money is going, what is the impact of this money. You can imagine, let me give you an example. When we went to our member state 1 week ago, I told them, with money that we received, and internally in Africa and from partners, this is how we use that. 3 days ago, they gave us $28 million additional, coming from our member state. I have countries like Angola, Morocco, and others pledging funds to Africa CDC because they see that we are not only transparent, but we are making impact. For us to respond to this kind of outbreaks, I was meeting the president of Ghana 3 days ago. He was telling me, Sierra Leone is burning. How can we prevent to have this outbreak in my country? I flew to Geneva. Then when I landed, I got a message from him, Ghana is infected. What it means? It means we need first to think about local manufacturing of vaccines. Let me tell you, every single day, when I say every single day, it means last year we had 213 outbreaks. This year, it will be even worse. It means it's almost 1 outbreak per day. Every single day, I have to think, where do I think I can find vaccines, medicines, diagnostics? Without this strong local manufacturing agenda, we will not move. Without global cooperation and collaboration, we will not move. We still have countries that pledged money for mpox. We didn't receive so far. We are calling them to continue to provide. And also, we need data sharing agreement. We need to know when something starts somewhere, all countries are informed on timely manner. I think this is what we are doing to manage this kind of outbreaks. We did it recently in Tanzania. You saw my action for Marburg in Rwanda. I think today, Africa CDC is on front line, working with all partners to deal with all outbreaks.
Very interesting. So you're really talking about how this crisis in financing and funding and multilateralism is creating opportunity, as we were discussing earlier, as I was mentioning earlier, for countries and the continent to galvanize that support for each other and focus on that. And also when you talk about that logistical challenge and making sure that you have that localized resource and ability to produce, that also creates economic opportunity. It's a virtuous circle as well. So that's really helpful. I'd love to understand a little bit about how that relates to other regions and how Africa CDC works with other regions. How important are regional partnerships in other areas of the world to the work that you're doing on the continent now?
It's so amazing. I think all of you saw this article in The Lancet. My brother Jarbas was leading PAO. We signed the MOU. Now PAO and Africa CDC, we are working together. I was with, I don't know if he's still minister in Singapore, Minister Ong. I was with my friend, I think he will be here after me, Budi, from Indonesia. Now, ASEAN, they want to create ASEAN CDC following the model of Africa CDC. Gulf CDC, they want to follow the model of Africa CDC. Why the model of Africa CDC? We need a strong political, strategic, and technical organization to lead the agenda and to talk with other continents. This is what we are doing. I think this article in The Lancet, I saw some people saying, why we cannot create the Latin America CDC? It's public. Now, the way Africa CDC is working is really to be connected with all regions and to work close with WHO at global level to facilitate the discussion. The last one, for the very first time, the DG Africa CDC is invited to the WHO. In the past, we were invited under the African Union. It's showing to you that today, Africa CDC is very well respected.
That's wonderful. And we're going to have Jarbas Barbosa here a little bit later, so we'll talk to him about that partnership as well. Africa CDC launched its new public health order, and you have a lot of interesting components in there on workforce, manufacturing you just mentioned, surveillance. What's most important? How do you prioritize those?
The most important for me is what is helping me to save lives of my people. I have so many people dying every day, first because we don't have availability of medicines, diagnostics, vaccines. And this is my first priority. The second priority, for us to have that, we need to rethink our health systems. You know, the problem is not just the head cut. The problem is the governance. If we have to stop today with fraud, corruption, misuse of funds, even with the current funding that we have in Africa, we can make an impact of more than 46%. It means, and this is the study that we conducted, it's available in our website. It means today, my priority is not to go back to request for ODA. My priority is to reform the health system in Africa. Do you know that only 16 countries out of 55 have national health development plan costed in Africa? If you don't have a plan, how do you want to request domestic funding? How do you want to talk with partners? This is why I'm saying, even to some partners who are coming to tell us they are filling gaps in other countries, I say, you are not helping us. Because we are continuing with the old model where people, they're not doing effort. Let us stop that. Let us move with another mentality. Let us push our countries. I'm an African, I'm a leader. I'm saying that with responsibility. You don't have a plan, you don't have a costed plan, you will not get money from outside. I did it even in my own country, DRC. They came to me, they said, I have 45 million plan for Mpox. I said, if you don't give money, we'll not get money from outside. They gave 10 million, and we got around 200 million for them. I think this is the model that we are following.
I like. Can you expand on that? We only have a few minutes left, briefly, on what role, where we've just spoken about how the funding and financing and different institutions that are supporting that have changed. How can the private sector support what you're doing?
If you read this book, you will see we have 3 pillars. The first one, more domestic resources. The second one, more innovative resources with what we call the Lusaka agenda, alignment. And the third one is the blended finance. It means investment from private sector. We need African and external private sector to invest. It's a win-win. Now in the world, we are talking about transactional approach. In Africa, we want people to know that they can make money and that money can also save our life. I think private sector is playing a key role, and we are putting in place the conducive environment for that.
We talk about that a lot at FP, and that's the reason that we focus on this sector so intently. Human ROI, human return on investment. It's about humanity, but there's also economic benefit in there. We only have about a minute and a half left, so just as a final kind of question, you're meeting with lots of people. We were trying to tally up how many meetings you have here this week. Let's just say for a moment your final meeting at the end of the week is with the leaders of the G7. What message would you want to convey to them? What would you like to say?
2 key messages. And I'm meeting Peter Sand, Sanya, I met Tedros. Yesterday I was with United. I was saying, my first message is, let us support replenishment of these organizations. Because 70–80% of this money is for my continent. This is the first message. The second one I'm telling them is, let you support us to rethink our health system in Africa. We don't want you to come to fill the gap. There is no gap to fill. There is a rethinking to do. Rethinking, it means help us to take the ownership of our program with your support, because we still need partnership. Please come to be aligned with us, and we'll make this huge impact, and that will be a win-win for everyone.
Wonderful. I think it's fantastic and great thoughts for you to share with us to kick off our program at the Global Health Forum here at WHA. We're so appreciative that you made the time for us. Dr. Jean Kaseya, please join me in thanking him.
Thank you so much.
Right this way.
Thank you so much.
Please.
Next, please welcome